How to diagnose Lewy body dementia. Lewy body dementia is a progressive form of dementia which can cause significant disruption to a person's life. It is characterized by a decline in mental abilities, memory loss, confusion, and visual abnormalities. It is also associated with hallucinations, difficulty in speaking, and physical tremors. The causes of Lewy body dementia are unknown, but current research suggests genetic and environmental factors may contribute to its development. It affects around 1 million people in the United States. The early stages of the condition can sometimes be difficult to identify, as symptoms may appear similar to other forms of dementia or psychiatric illness. If left untreated, the disease can take a significant toll on quality of life, leading to further mental decline, physical impairment, and disability. Early diagnosis is important for the effective treatment of Lewy body dementia, as it allows the doctor to create an individualized plan and make appropriate changes to lifestyle that can help slow the progression of the disease. Fortunately, with advances in medical science, there are now a range of tools available to help diagnose the condition. Brain scans, cognitive tests, and diagnostic criteria have all been developed to assist doctors in accurately diagnosing Lewy body dementia. It is important to remember that Lewy body dementia is a serious condition, but it is not a death sentence. With careful monitoring, medication, and lifestyle changes, many individuals can live full and active lives. It is an unpredictable condition, but with the right support and intervention, those affected can still lead long and enjoyable lives. Diagnosing Lewy body dementia. Diagnosing Lewy body dementia, LBD, is not always easy and requires a specialist's opinion. It usually involves several steps and a variety of tests and evaluations. A doctor familiar with neurology, psychiatry, and geriatrics can usually make a diagnosis, but it can take several visits to different specialists to be sure. The first step in diagnosing LBD is usually to identify the presence of cognitive and physical symptoms and to rule out other causes. This includes questions about medical history, a physical exam, and lab tests. Some common tests for diagnosing LBD are neuropsychological tests to assess memory, thinking, and language skills, brain scans such as an MRI or CT scan to look for signs of damage, cerebrospinal fluid analysis to measure the brain's chemical content, blood tests to check for other possible causes like vitamin deficiencies, genetic testing, though this is not always necessary. It is important to remember that these tests are not foolproof, and there is no single test that can definitively diagnose LBD. However, the information gathered from the tests can help the doctor identify patterns of symptoms and better understand the patient's condition. What symptoms should you look out for? When diagnosing Lewy body dementia, it is important to look out for a range of symptoms. Cognitive symptoms can include memory loss, difficulty concentrating, and confusion. Behavioral symptoms can range from hallucinations and delusions to anxious behaviors such as pacing or agitation. People with Lewy body dementia can also experience motor symptoms, including slowed movement, tremors, stiffness, or balance problems. Other physical symptoms may include loss of appetite, weight loss, sleep disturbances, or vision problems. It is advisable to speak to your doctor if any of these symptoms are present, as they could indicate Lewy body dementia. The more information you provide about any changes in behavior or cognition, the better your doctor will be able to diagnose the condition. Treatment for Lewy body dementia. If you or a loved one have been diagnosed with Lewy body dementia, the next step is to consider treatment options. There are a range of treatments available for managing the symptoms of Lewy body dementia, including medications, behavioral therapy, and lifestyle changes. Medication. Medications can be used to help manage some of the symptoms of Lewy body dementia, such as memory loss and confusion. They may also help reduce other symptoms, such as hallucinations, mood disorders, and difficulty sleeping. Commonly prescribed medications include cholinesterase inhibitors, antidepressants, antipsychotics, and anticonvulsants. Behavioral therapy. Behavioral therapies can be beneficial in helping individuals learn how to cope with the symptoms of Lewy body dementia and can also help those around them understand and manage their condition. Cognitive stimulation therapy CST, is one way that can help preserve and improve memory and cognitive functioning. Occupational and speech therapies can also provide ways to help manage day-to-day tasks. Lifestyle changes. Making healthy lifestyle changes can help manage the symptoms of Lewy body dementia, as well as reduce the risk of developing the condition. Healthy eating, regular exercise, avoiding stress, and getting enough sleep can all help overall well-being and brain health. Other changes, such as avoiding alcohol and reducing time spent sitting, can also be beneficial. Prevention of Lewy body dementia. Though Lewy body dementia, LBD, is currently incurable, there are steps that can be taken to reduce the risk of developing this condition. Though there is no surefire way to prevent LBD from occurring, research has indicated certain lifestyle changes can be beneficial in preserving mental health. Engaging in physical activity on a regular basis is thought to strengthen cells and connections in the brain, as well as improve blood flow, which can increase alertness and mental clarity. In addition, research shows that improving overall diet can lead to better cognitive functioning and mood. Social engagement is also important in maintaining healthy brain functions and reducing the likelihood of developing dementia. A vibrant social life can provide emotional support and keep people engaged in activities which can help build a positive relationship with their environment. Furthermore, intellectual stimulation can help provide an outlet for creativity and enhance cognitive functioning, which can be beneficial for preventing the onset of LBD. Ultimately, the best way to reduce the risk of developing LBD is to take all of these preventative measures into account and maintain a balance between them. It is important to strive for a healthy lifestyle of both physical and mental activity and social engagements. By doing so, and consulting a doctor regularly, the risk of developing LBD can be lessened. Conclusion. This guide has covered the diagnosis, symptoms, and treatment of Lewy body dementia. We've looked at brain scans, cognitive tests, differential diagnoses, and prognosis, offering insight into how to diagnose this condition accurately and effectively. We have also discussed prevention methods and coping strategies for living with Lewy body dementia. Making informed decisions about this condition and understanding the potential risks and outcomes is incredibly important. If you're worried about your own, or a loved one's, risk of this condition, speak to your doctor immediately. Thank you for watching. Don't forget to hit that subscribe button and ring the notification bell so you never miss an episode of Caregiver Relief.